Dominic, how you doing today?
Doing great. Thanks, Flex, for having me.
Yeah, it's good seeing you, man.
You too.
Yeah, I mean, I could say a long time no see, but saw you recently at an event that you hosted in the West Loop.
Yes.
It was really creative. I think the topic was what, rapid mind reset?
That's right.
Okay.
Rapid Mind Reset,
Yeah,
RMR. Want to brand that?
Yeah. Tell us a little bit about that.
Sure. So, Rapid Mind Resets, we're in a fast-paced culture, and I been doing, many years of interviewing patients. I do a lot of talk therapy. There's a lot of stress in the city, and my patients may have they might not be taking their medicines. Hey, you're stressed out. Let's open up. So 5 to 10 minutes, I get intense, and I try to focus on one problem. They may say I have different categories. We talked about it 2 weeks ago at my presentation. There's 10 major categories of stress: relationship stress, work stress, financial stress, etc. We focus on work stress at my presentation 2 weeks ago, but and that's a top stress of my patients. And I say, hey, what's bugging you? It's about getting insight into your stresses. Stop. Why am I feeling lousy right now? Oh, well, okay, bring it to the surface and understand the why. This is Rapid Mind Resets.
I think someone's trying to reach you on your phone, Dominic.
Yes.
Yeah. It's all right. It's a life of a busy
I was
doctor.
so into it, I didn't even hear the buzz. So I'm here. So that's okay. We'll let it go for now. And so yes, it's really it's about the most important part of this process is you can't solve a problem if you don't understand a problem.
Sure.
To understand a problem, you have to bring it to the surface. Sometimes that's a little painful, but be honest with ourselves. No illusions. What is bugging you? And, in a safe space in my office, I've, been able to bring it to the surface, many things, and understand the why is the next part of it. And then Rapid Mind Resets, there's 3 or 4 common and maybe other interventions you can do at the time: deep breathing, meditation, and there's apps that help us with this. Yeah, okay, go to app, kind of distresses us. Media distresses us sometimes, but sometimes media, there's a common app called Calm that we can go to, and there's nice. I like the rain and the mountain water. That's my favorites. Yeah. And we can listen to that for a little bit after kind of decompress. And you got to say, I got to table some of this stuff. I can't solve all these problems right now. 5 or 10 minutes, you go, and then you reach out to support if you need to. And during that 5 or 10 minute periods, rapid, and it's going from basically Rapid Mind Reset. In summary, is going from a negative state, fear, doubt, anxiety, worry, an intervention, a realization, to a positive state, peace, and de-stress.
Okay. So you're internal medicine, right?
Yes.
Okay. So why would someone listen to you as opposed to a psychiatrist or a psychologist?
Okay. I'm going to explain a little bit what internal medicine is, because people think I'm a surgeon, and I'm not a surgeon. I do minor surgery, sutures and stuff, every once in a while, but that's not too many other minor. But internal medicine is
so you don't make visits at hotels if people have accidents?
No,
okay.
I don't. I'm an adult primary care doctor.
Got it.
So the main doctor you go to, but I'm hospital-based, so I take care of patients in the hospital as well. But basically, an adult primary care, that you go to, and I through the years, and it's been a problem. You can't get a patient to a psychiatrist; they may need it. Sometimes it's just stress. Sometimes they have general anxiety disorder. Sometimes they have panic disorder, and I need to help them counsel at that moment.
Sure.
And of course, I refer them out to psychiatrists for some more serious issues. But a lot of primary care, 70% of mental health is taken care of, or at least attempt to take care of in primary care. And I would say it's not always taken care of effectively in primary care. I try to do my part to address these issues and help the patient out on a path toward taking care of these stresses before they get too bad. And they are affecting their diabetes, their high blood pressure, their asthma, because they're not taking their medicines, and their sugars are going out of control. And say, hey, you know what? We could deal with the stress. Also, you got to get help. I want to help you get your body in order. But right now, the first thing as a primary care doctor, I have to prioritize. I got to get your head in order first, deal with your stress, and then we'll help you get your other physical problems in order too.
All right. Well, that's good. That's good to know. I mean, with the event itself, going back, to that, right? So
Sure.
it was really different. I mean, you and I have done a number of events, for our group of friends, and also the complete, strangers, that are
Sure.
medical events, but they're also networking. So it's like a happy hour event, right? But that event, tell us a little bit about, why did you produce it the way you produced it? Because I do remember there were actors that
Yes,
were involved, and you didn't tell anyone they were
Right.
actors. So,
Right.
yeah, there was a lot
Okay,
going on. There
well-
was a lot going on there. So it's really interesting to have that, behind the scenes.
Right. So I know theater. I took Second City for a year. I produced little plays when I first came to the city. So I want to do something that I enjoy in this vibrant city. I had a couple professional actor friends that I got involved as plants. And I wanted to illustrate the 5 aspects of work stress. We were talking about work stress. So I was going through my slide presentations, and I had a foreshadowing, which I kind of planted in there. Guy was interrupted when I first started talking. And then later on slide 14, I had a plan. They had a cue. I had 40 slides, 40 minutes, a little bit long, but I usually try to stand off, 30-minute lecture. But I was going there, and there was a cue for this dramatic scene with 2 workers fighting, a boss and a worker, and I was illustrating an aspect of a new boss coming on. That's statistically, this is one of the biggest stresses in work. You don't know your responsibilities when a new boss comes in. Yeah. And there was poor communication there. There was high workload. There was a work-life balance issue. All the things that are top things that cause statistically workplace stress. I illustrated it best with these 2 wonderful actors. And there was a moment, I think, that a few people, including you after, said that they wanted to pull those guys away from me. They were interrupting my lecture, but then they got it. People got it was part of the show. And I think it was probably one, and I'm going to do some more of this because it was so well received. These guys are good,
Yeah.
And
They're professional actors.
They're professional. They were in movies together back in 2005.
So one of the guys was sitting down, and he's just not interacting with anyone, but he looked like he was busy. He was working, and
yes.
And the other guy was, his boss, so it was fascinating to see the interaction. Now, did you put together a script for that, or how did that happen?
I scripted it about a week before the presentation. We rehearsed 3 days before on Zoom. And these guys were such professionals. They wanted to do another rehearsal the day of. I was rounding at the hospital, and I helped them set it up a little bit. And
so in between patients, you're...
Yes. Well, this is common. I switch up. Switch up. Like one of my doctor colleagues calls me Dr. Switch because he sees me switching up in the hospital.
Sure.
And I switch to some of my passions.
Yeah.
You have your vocation.
Sure.
Which is me, medicine. It's always most important. And then my avocation, my passion, these other projects for production, and presentation, et cetera.
Yeah.
And sometimes during the day I take a moment and I have to attend to some things like a lot of people that have these you can call it a side hustle, but I think it's a little bit more for me and some other people. It's a passion of mine that I love, and
You're balancing the right and left brain.
Yeah.